Dear students, welcome back. Now here we are going to deal with the skeleton of thorax or thoracic cage. It is an osteocartilaginous. It is an osteocartilaginous. Osseo means the bone and cartilage means here you will have the cartilages. Okay, elastic cage. So it is having some elasticity and which is primarily designed for increasing and decreasing the intrathoracic pressures. So the pressure which is increased during inspiration. So during inspiration what will happen? The ribs are going to expand. Okay, during expiration again it will come to its normal position. So if it is completely a bone, it doesn't have such kind of expansion. So here the cartilaginous structures helps in the elasticity of this cage. Okay, so it is an osteocartilaginous elastic cartilage which is primarily designed for increasing and decreasing the intrathoracic pressure. So the pressure inside this thoracic cage. Okay, during inspiration the intrathoracic pressure is less and during expiration the intrathoracic pressure is more. Okay, so whenever the space inside the thorax is less, then the pressure will be more. If the space inside this cage increases, the pressure is going to decrease. Okay, so that air is sucked into the lungs during inspiration and expelled during expiration. So by increasing, when it is going to increase during inspiration, the thoracic cage is increased. That means expansion of this thoracic cage increases, which leads to decrease in intrathoracic pressure through which the air is sucked into the lungs. Okay, and during expiration the air is expelled out during expiration, then the intrathoracic pressure is going to increase. Okay, so this is about the main function of this thoracic cage, why it is designed like this. Okay, how it is going to form, how this thoracic cage is formed. So anteriorly, actually this thoracic cage consists of many bones. So anteriorly it is having sternum and 12 pairs of ribs, and posteriorly it consists of 12 thoracic vertebrae. So normally in a vertebral column, so we are having 33 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 5 sacrum and 4 coccyx. So in the thoracic cage, this thoracic vertebra, 12 thoracic vertebra takes part in the formation of thoracic cage. In the vertebral column, this thoracic vertebrae having more stability than the remaining vertebrae. Okay, now so anteriorly the thoracic cage is formed by the sternum, okay, and posteriorly by 12 vertebrae, 12 thoracic vertebrae along with the intervertebral discs on each side, 12 pairs of ribs, along with its costal cartilages. Okay, so again we will see formation. It is formed anteriorly by the sternum posteriorly by 12 thoracic vertebrae. On the sides, it is formed by 12 pairs of ribs, 12 pairs of ribs, and its costal cartilages, along with its costal cartilages. So, this is the formation of thoracic cage, and each of the part is articulating with each other. So, here the ribs is forming connection between the thoracic vertebrae and the sternum, and also along with its costal cartilages. Okay, each rib articulates. So we are having 12 thoracic vertebrae and we are having 12 ribs, isn't it? Each rib is going to articulate with each thoracic vertebrae on the posterior side. But on the anterior side, all 12 ribs are not directly articulating with the sternum. Okay. Anteriorly, only 7 ribs are directly articulating with the sternum. Okay, so these ribs are called true ribs. What do you call? True ribs. So these are also called as vertebrosternal ribs. So that means 7 ribs are connecting the vertebrae to the sternum, so they are called as vertebrosternal ribs or true ribs. The ribs which have direct connection along with its costal cartilages to the sternum and the vertebrae is called as true ribs. Okay. The costal cartilages of next 3. So 1, 2, 3, 4, 5, 6 and 7. After that, next 3, that means 8, 9 and 10. 8, 9 and 10. End by joining the next higher cartilages. So 8th, 9th and 10th. So here it is 7th is the direct connection. After that, 8th one is going to attach with the 7th costal cartilage. Okay, and 9th one is going to attach with the 8th costal cartilage, and 10th one is going to attach 9th costal cartilage. So that means the costal cartilages of the next 3 ribs end by joining the next higher costal cartilages. So these ribs are therefore known as, so posteriorly each rib is attached with the vertebrae. So here we can see 1, 2, 3, 4, 5, 6, 7. After that 8th one. So this 8th one is attached to the vertebrae, and then anteriorly it is not attached to the sternum. So it is attached to the costal cartilage, isn't it? 8th one is attached to the costal cartilage. So this one is 8th one. This is the 8th one is attached to the costal cartilage. So such ribs are called as vertebro. So here where it is getting attached, chondra, that means cartilage. So they are called as vertebrochondral ribs. What you call? Vertebrochondral ribs. So these vertebrochondral ribs are called as false ribs. What you call? False ribs. Okay, why it is called false? They are not attached to the sternum, whereas upper 7 ribs are attached to the sternum as well as the vertebra on the posterior aspect, so they are called as true ribs. So those ribs are called as vertebrosternal ribs. These 7 ribs are called as upper 7 ribs are called as true ribs, whereas the lower 3 ribs are called as false ribs because posteriorly it is attached to the vertebrae. Anteriorly they are attached to the costal cartilage of higher rib. Costal cartilage of higher rib. Such ribs are called as vertebrochondral ribs. They are called as false ribs. Okay, and the costal cartilages of 7th, 8th, 9th and 10th ribs forms the costal margin. What you call? It forms a costal margin. So, when we have discussed this costal margin, when we deal with the surface landmarks of pectoral region. Okay, so remember that one. Okay, next one, the anterior ends of the 11th and 12th ribs are free. If you see this, so only 10. So here we can see the 11th and 12th. This one is the 12th rib, and above that one, so this one is the 12th and this one is 11th. 11th and 12th ribs doesn't have any connection on the anterior side. Doesn't have any connection on the anterior side. So these ribs are free. These ribs are attached on the posterior aspect only. Here you can see this one. This is the 12th rib and this one is the 11th rib. So all these end up here. They will not come on the anterior aspect. So these ribs are free. What do you call? These ribs are free. And these are called as floating ribs. These 2 pairs of ribs are called as floating ribs. Okay, the vertebrochondral and vertebral ribs. So these 2 ribs are called as vertebral ribs. So it doesn't have any connection with the cartilages or sternum. So these ribs doesn't have any connection either with cartilages or sternum. So it is having connection with the vertebrae. So these 2 ribs are called as vertebral ribs. These 2 ribs are called vertebral ribs. Okay, and so these 2 ribs are called as floating ribs, and these 2 is not connected with the sternum anyway. So these are also considered as false ribs. These are also considered as false ribs because they do not articulate with the sternum. They do not articulate with the sternum. Okay, so how many pairs of ribs are there? We are having 12 pairs of ribs, out of which the upper 7 ribs are called as true ribs. The upper 7 ribs are called as true ribs because they attach with the vertebrae as well as the sternum. So these ribs are called as vertebrosternal ribs, and these are called as true ribs, whereas the next 3 ribs, 8, 9 and 10th ribs are joining the next higher costal cartilages on the anterior aspect, and posteriorly they are attached to their corresponding thoracic vertebrae. So, and these 7th, 8th, 9th and 10th ribs forms the costal margin, and 8th, 9th and 10th ribs are called as vertebrochondral ribs, and these ribs are called false ribs The next two ribs will articulate only with the vertebrae on the posterior aspect. On the anterior side, these 11th and 12th pair of ribs are free. So these two ribs are called as vertebral ribs, and these are also called as false ribs because they do not articulate with the sternum. Okay. Now it is possessing some joints. So it is possessing some joints which permits in the movements of thoracic cage. Actually, it is having many joints in the thoracic cage. The main joints in the thoracic cage helps in the movements of thoracic cage during breathing are costovertebral. So that means costa means rib, vertebra means vertebrae. Costovertebral joints. And also the sternum will have the upper portion manubrium, and the next one is the body. So this manubriosternal joints here, this is the manubriosternum joint, and this one is the costovertebral joints, and next joints are the chondrosternal joints. Chondrosternal joints, that means the cartilage which is attached to the sternum forming a joint called as chondrosternal joints. So what are the three joints which helps in the movement of thoracic cage during respiration? Or yes, costovertebral joints. Here we can see the costovertebral joints and manubriosternal joints and chondrosternal joints. The next one are chondrosternal joints permit movements of the thoracic cage during breathing. So this is about the formation of the thoracic cage. In the next session we will see the shape of the thorax. Okay, in the next session we will see the shape of the thorax. Thank you.